Well, thank you very much for the fascinating presentations about very different models for healthcare. Two of them, I think, look very much to the future as to what healthcare will be, and to try and bring it to the present. The final one, the first one, I think was looking at healthcare as something that's rooted in the past as well as in the future. And I think while you were talking, I was having a very naughty thought, which is that this is like the Grail legends. It's about the relationship between anxiety about the land and the way it's healed. And I wondered if that was something that had even crossed your mind.
Loosely, I guess. I think when you said it's rooted in the past, I mean, what we're trying to do, what we think we were trying to do, was look back over ancient ideas of healing and try and bring them into the 21st century and add them into contemporary care. I guess to a degree, yes, there probably was some of that thinking.
Yeah. Well, I also think that particularly in Pune, but also in Dubai, what you're looking at is a very different reshaping of the city. And hospitals are awkward elements in cities because they used to be about infectious disease. So actually you want the hospital as far out of the city as it can be because you don't want to bring infection into the city. So they've always sat unhappily in the city fabric. And I think what you're both doing is showing how the modern hospital, or the hospital of the next 10 years, let's say, can sit much more comfortably within the city. And Pardis, I have a question for you, which is there a particular reason why you made the healthcare an island in the sea as opposed to an island in the desert?
We were, as I mentioned, we were trying to make it available for everybody, and we wanted to make sure that it provides the futuristics of healthcare and medical services that we had in mind. So we designed it in water to take a normal distance from land, and also provide the views and the isolations that people may need at the time of healing.
Yeah. Good. And Mandviwala, do you think that you could go on to design a whole city on the same basis as you're designing a hospital and research facility?
For sure, given an opportunity, we like to get to the root of the where it can resonate with the common people of the local area.
Yeah.
And it makes a lot of difference, especially when you're talking of a health city. Because in India, people are not very comfortable still going to very big hospitals. They want to go to a small nursing area, or they want to go to a small practitioner, and they want to come back.
Yeah.
The idea is, how do you pull people, how do you create a comfort zone for people? Rather than just walking into a very huge structure, a very big hospital, which monetarily wise also they feel scared because there's not so much of insurance to back them. On the other hand, they are very scared of what is going to happen once they enter the hospital. So the idea is, how do you scale down the hospital when the person approaches? How do you make it softer? How do you make it more humble for the people to come in? A more warmer place, something soothing. And the concept of getting patient-centric is something which we have not really seen.
Yeah.
Right from color psychology to even the using environment to heal people, or connecting greenery into the things. And keeping the other sciences together is something which is very unique. So, and still very interactive. You can go from one area to the other area, you can move around, you can, and be visually connected also.
And I think that's one of the striking things about your proposal, is that it's rooted in the idea of human beings who might need healthcare, rather than people who need healthcare and have to be treated as if that's the only thing that matters. So that's a fascinating series of discussions. Thank you very much. And
Thank
now
you.
it's my pleasure to give you your reward for, winning a WAFX prize.
Thank you, sir.
Could we? You're happy.